In the ever-evolving landscape of healthcare, ensuring patient safety and delivering high-quality care are paramount. The National Accreditation Board for Hospitals and Healthcare Providers, or NABH, drives excellence in the Indian healthcare system. The NABH standards, updated periodically, serve as a roadmap for hospitals to enhance services and prioritize patient well-being. The third edition of NABH standards, launched in 2022, marks a significant step forward. This edition introduces new standards and strengthens existing ones to address evolving needs. Objective elements provide measurable criteria for hospitals to demonstrate compliance and commitment to quality. By adhering to these standards, hospitals can create a culture of safety and improve patient outcomes. The third edition of NABH standards represents a significant evolution in healthcare quality standards. This edition incorporates the latest advancements in medical science, technology, and patient care practices. One of the most notable additions is the enhanced focus on patient-centered care. The new standards emphasize patient engagement, communication, and respect for their rights. Another key update is the inclusion of standards related to healthcare technology management. This includes standards for electronic health records, telemedicine, and medical device management. Furthermore, the third edition strengthens the requirements for infection control and prevention. By embracing these updates, hospitals can ensure they are providing the highest quality of care to their patients. The third edition of NABH standards stands on 5 foundational pillars, each representing a crucial aspect of healthcare quality. First, the patient is at the heart of everything. Hospitals are encouraged to see care through the patient's eyes. Second, timely and appropriate care is emphasized, ensuring a smooth patient journey. Third, minimizing risks and preventing harm to patients is crucial. Fourth, effective hospital management is essential for high-quality care. Finally, quality is a continuous journey, emphasizing regular evaluation and improvement. These pillars create a framework for delivering safe, effective, and patient-centered care. To make the implementation of quality standards more practical and measurable, the NABH framework uses 2 key components: standards and objective elements. Think of as the broad goals or principles that hospitals should strive to achieve. For instance, one standard might be, patients receive care in a safe environment. Are the specific, measurable actions or criteria that demonstrate whether a hospital is meeting a particular standard? For example, an objective element related to the safe environment standard might be, the hospital has a system in place to prevent falls. This structure ensures that hospitals are not just aiming for vague goals, but are taking concrete and demonstrable steps to achieve them. The objective elements provide a clear roadmap for hospitals to follow and allow for objective assessment during the accreditation process. Section 5. Putting patients first. Standards for patient-centered care. In the third edition of NABH standards, patient-centered care takes center stage. Gone are the days of a one-size-fits-all approach. Now, the focus is on treating each patient as an individual, recognizing their unique needs and preferences. These standards encourage hospitals to involve patients in their care decisions. This includes providing clear and understandable information about their condition, treatment options, and potential risks and benefits. Respecting patients' rights is also a key aspect. This means ensuring the right to privacy, confidentiality, and informed consent. Providing emotional support is another crucial element. Recognizing that illness can be a stressful experience, hospitals are encouraged to provide emotional support to patients and their families. For example, hospitals might implement practices like using patient portals to give patients easy access to their medical records and test results, providing translators for patients who don't speak the local language, and having dedicated patient advocates who can help patients navigate the healthcare system and address their concerns. Section 6. Steering the Ship, Governance and Leadership Standards. Effective leadership and governance are the backbone of a high-performing hospital. The NABH standards recognize that quality healthcare starts at the top. The governance and leadership standards focus on establishing a clear vision for quality and safety. The hospital leadership must be fully committed to creating a culture of safety and continuous improvement, ensuring accountability. Clear lines of responsibility and accountability must be established at all levels of the organization. Promoting ethical behavior. The hospital should have a code of ethics that guides the conduct of all staff members. For example, hospitals are encouraged to establish a governing board that is responsible for overseeing the hospital's quality and safety program. Conduct regular leadership walkarounds to identify and address potential safety concerns. Provide ethics training to all staff members. Section 7. Combating threats, infection control and risk management. Hospitals can be breeding grounds for infections if proper precautions are not taken. The NABH standards for infection control and risk management aim to minimize these risks and protect both patients and healthcare workers. Key areas of focus include hand hygiene. Proper hand hygiene is the single most effective way to prevent the spread of infections. Environmental cleaning. Hospitals must have rigorous cleaning protocols to disinfect surfaces and equipment. Isolation precautions. Patients with infectious diseases must be isolated to prevent the spread of infection. Antimicrobial stewardship. Hospitals must have programs in place to ensure the appropriate use of antibiotics. Practical examples include placing hand sanitizer dispensers throughout the hospital, especially at points of care. Using color-coded cleaning materials to prevent cross-contamination. Having dedicated isolation rooms with negative pressure ventilation. Section 8. The power of proof documentation and continuous improvement. Documentation is not just paperwork, it's the backbone of quality improvement. The NABH standards emphasize the importance of maintaining accurate and complete medical records. This documentation serves several purposes. Continuity of care. Accurate records ensure that all healthcare providers involved in a patient's care have access to the same information. Legal protection. Medical records serve as legal documents and can be crucial in the event of a malpractice lawsuit. Quality improvement. Analyzing data from medical records can help hospitals identify areas where care can be improved. Continuous quality improvement is an ongoing process of identifying areas for improvement and implementing changes to enhance patient care. Hospitals are encouraged to regularly review their clinical data to identify trends and areas for improvement. Implement quality improvement projects to address identified issues. Monitor the effectiveness of these projects and make adjustments as needed. Section 9. Reaping the rewards. Benefits of NABH accreditation. Achieving NABH accreditation is a significant achievement for any hospital. It signifies a commitment to providing high-quality, patient-centered care. The benefits of accreditation are numerous and far-reaching. Enhanced patient safety. By adhering to stringent standards, hospitals create a safer environment for patients, reducing the risk of medical errors and infections. Improved patient outcomes. Quality care leads to better patient outcomes, including shorter hospital stays, fewer complications, and improved overall health. Increased patient satisfaction. Patients are more likely to be satisfied with their care when they feel safe, respected, and involved in their treatment decisions. Enhanced reputation. NABH accreditation serves as a mark of distinction, enhancing the hospital's reputation and attracting more patients. Continuous improvement. The accreditation process encourages hospitals to constantly evaluate and improve their processes, fostering a culture of excellence. Ultimately, the pursuit of NABH accreditation is about more than just meeting standards. It's about striving for excellence in all aspects of healthcare delivery.